We're continuing our coverage now on Mental Health Awareness Month. Lexi Suter sitting down with 3 different kinds of clinicians from the Family Institute at Northwestern to offer you, our viewers, some real advice and takeaways that you can apply immediately.
I love that she's doing this. So the topic this half hour is kids and how to help them navigate difficult news and living in this digital social media age.
When deciding if your child should see a therapist, Dr. Tramaine Presley says you should consider the rule of 3: intensity, duration, and interference. How big are the child's reactions? How long has this been going on? And are their emotions interfering with eating, sleeping, or school? Clinicians are seeing more kids with anxiety and the social pressure to perform. Dr. Presley says there are a few things to watch for.
Is your child becoming overly clingy or needing constant reassurance? Or what about aches? Aches happen a lot. So sometimes anxiety can manifest itself in physiological symptoms. And so sometimes your child may start complaining about that mystery headache or that stomach ache. Is your child avoiding going to school or hanging out with friends and peers? Usually that's another sign that I would say is consistent with anxiety. Usually we want to avoid the thing that makes us scared or nervous.
Of course, therapy can be very helpful for children as a proactive tool, and you don't have to wait until a mental break or a crisis to find someone for your child to talk to. And Dr. Presley did stress too, I know you're both mothers, you're great parents. You got to take care of yourself when you are also dealing with problems with your children.
That's a really important point, because I do sometimes think we're so focused on kids, we don't think, but that's important for the parent to be coming at it from a healthy standpoint as well.
And one thing that I spoke with this therapist about was looping parents in. What is that boundary? What does that look like when your child goes into therapy, right? Maybe they start as young as 5 years old. What does that look like? They loop the parents in. Make sure you're a part of this progress.
And what about controlling the social media element? Because there's so much that comes with that you don't always see.
Right. No, look, I think we've seen a lot of places and they limit social media. There's bans in different countries. I think you definitely have to know your child best, and you've got to set those limits if you know what is best for them. I think especially when you're a young person and when you're growing, you don't always know what's best for yourself.
Oh, no question.
And Family Institute open to everyone.
It is open. They have clinicians you can pay for that go through insurance. They also have help that is completely free right here on Michigan Avenue.
All right. Mental health, so important.
Yes,
Mental Health Awareness Month.
Thank you.
Thanks for doing these reports, Lexi.
Yeah, of course.